you've been working as a nurse since 2007. So
Mm.
roughly about 13, 14 years. Wow, at taas na ng
Yeah.
point niya sa salary. But we're not gonna talk about that, okay?
What's up you guys, welcome back to my channel. If you are new to my channel, please don't forget to subscribe, turn on the notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Okay, so what's up? This is another episode of our series, Nurse in Action, wherein we put the spotlight on nurses here in Ireland to explain to you and to give you an idea how's it working here in Ireland, especially in their respective departments. So today guys, we are going to talk about Coronary Care Unit, CCU. So, without further ado, let's meet our special guest.
Guys, as I mentioned earlier, we are going to talk about Coronary Care Unit or CCU, and we are joined by Cliff Castaneda, a CCU staff nurse here in Dublin, Ireland. Hi, Cliff. How are you?
Hi Raymond, good morning and good morning to all your subscribers. I'm okay. Actually ngayon naka-annual leave ako for 2 weeks. So,
Wow.
ayun.
Minsan sarap pag naka-leave, no? Siyempre hindi ka na, wala kang masyadong isiping work, di ba?
We always need time away from work eh. So, it's
Exactly.
very very important.
Cliff, thank you so much sa pagpapa-unlock mo sa Nurse in Action series natin. And we are going to talk about CCU. So basically all about your experience working here in Ireland. So how long have you been here, by the way?
Dumating ako sa Ireland June of 2019. So, more or less magto 2 years
Magto
sa
2 years
June.
na. Ang bilis ng panahon. For us to know you more, can you just give us a brief introduction of yourself?
I'm originally from Davao City, Philippines. Qualified nurse since 2007. My initial work experience was with St. Luke's Medical Center in Global City. So I was one of the pioneer nurses there at that time.
Okay.
And then I went to work in Saudi Arabia, in Jeddah, Saudi Arabia, in one of the military hospitals there. And then after 7 years, I decided to uh, transfer here in Dublin.
That's good. That's good. And just a quick question. What made you decide to transfer here in Ireland?
I've been asked that question several times na rin. Hindi ko first choice yung itong Ireland talaga. Hindi ko talaga siya first choice. But then, what made me decide to go here is that Ireland had the most promising benefits with regards to family especially and career-wise as well. At saka before pa ako makarating dito, I've heard of good things sa mga nurses na nandito sa Ireland, especially mga katulad nating Pinoy na masaya sila where they are. And then yung work-life balance, yung nakita ko sa Ireland. And aside from that, yung compensation. Yung Ireland kasi counted yung previous experience natin.
Exactly. Yes.
So compared sa no offense sa mga taga UK, pero yun talaga yung defining
Yes.
factor bakit ko pinili yung Ireland over UK.
You've been working as a nurse since 2007. So
Mm.
roughly about 13, 14 years. Wow, at
Yeah.
taas na ng point niya sa salary. But we're not gonna talk about that, okay? For almost 2 years na dito sa Ireland as a CCU staff, before applying here, ano yung mga prerequisite ng agency or ng employer mo?
Obviously, yung English exam,
Okay.
prerequisite yun. And then, sa agency ko sa Philippines, very strict sila with regards to your CV. So, meron talaga silang format na fina-follow. And sobrang stricto nila doon. Kailangan talagang i-follow mo yung format nila. Pag nagkamali ka lang ng konti, di-disregard nila yung CV mo. And more importantly, talaga yung experience mo. I was just so blessed na at that time they considered my application and nandito na tayo ngayon.
Blessing talaga yan. And now, let's talk about your CCU experience dito sa Ireland. Are you working in an HSC facility or a private institution?
Yes, it's a HSC facility.
Okay. So guys, when you say HSC facility, parang government ano yan, government institution dito sa Ireland. Okay, so tell me, how is your typical day sa unit mo?
We usually work 3 to 4 shifts a week. Start at 7:30 in the morning. Our day starts with a big handover. Ibig sabihin nun, lahat ng day shift staff, we will gather in the same room with the CNMs, the managers, the clinical facilitators, and then we receive handover from the desk nurse from the night shift. And then each of us, meron na kaming handover sheet na typewritten. Kumbaga, nasa computer yon. So, ina-update na lang namin every now and then. Mas mabilis yung pacing ng handover. Andun na yung details, yung diagnosis, yung plan. And basically, ang hina-handover na lang sa amin, yung mga special
Okay.
things na kailangan namin malaman.
And I just want to ask, dun sa huddle na yan, sa big huddle na yan, meron pa ba kayong specific staff-to-staff handover kapag katapos ng big endorsement na yan?
Yes. So after nung big handover, typically that lasts around 10 to 15 minutes depende sa acuity or complexity ng patients. And then after that, we get our patient allocation.
Okay.
So kung sino yung patient assignment namin, whoever is looking after those patients sa night shift, mag-hand over sila sa amin. Just a quick handover, basically kung ano yung nangyari last night, and then yung medications, very important, tsaka any special handovers na kailangan nilang sabihin sa amin.
So yung sinasabi mong death nurse, yung ba yung CNM ng night ang nag-endorse sa huddle na yon, or senior staff?
Yes. Sa unit namin, meron lang kaming isang CNM2, and then meron kaming dalawang CNM1 or Clinical Nurse Manager 1. Yun lang yung managers and walang nag-duty pag night shift. So, yung kami mismo, nagiging charge nurse or desk nurse din kami every now and then.
By the way, ilan ba yung census ng unit nyo?
9-bedded unit. And 2 of them is HDU. So basically, CCU slash HDU kami.
So per staff, how many patients you're handling?
Pag cardiology patients, nasa 1:3 kami. Pag may hawak ka ng HDU, so 1:2 ka lang. One HDU and 1 CCU, 1 cardiology na patient.
Okay.
During day shift, 5 nurses on duty. 1 on the desk and 4 bedside nurses. Pag night shift naman, mas less ng isang staff, 4 lang ang full staff. So isang desk nurse and 3 bedside nurses.
Not too bad, no? Kung 9-bedded siya tapos 4 bedside nurses, parang okay din yung allocation. No, it's not not too hard. You also have a healthcare assistant to assist with you. That's good.
Meron.
That's good. Iba ba to sa CICU, yung coronary ICU? Or parang step down siya ng CICU?
Our hospital, apparently wala kaming cardiac surgery.
Okay.
So meron kaming cath lab. So basically yung coronary care unit, ang kinikater lang namin is cardiology patients. So mga PCIs, device implantation, mga pacemakers, gano'n. Heart failure patients. Yun yung typical na mga patients na cardiology patients. Yung HDU beds naman namin, kumbaga kami yung step down ng ICU namin. So, pag mga extubated patients or naka-trachea na who are stable enough to go to our unit, out from the ICU, kami yung nagki-cater nun. Nagva-vary naman per institution, pero hindi kami capable mag-handle ng ventilated patients dito sa Dublin.
Dito sa Dublin. So how many hours yung shift nyo sa unit nyo or sa hospital nyo?
Pag day shift, we work from 7:30 to 8:30. Pag night shift naman, 8 to 8.
And lagi ko tinatanong to sa mga gantong interview, yung break time. How many hours yung break nyo in the morning and at night? Kasi for sure, yung mga nurses curious about that. Kung nakapag-break ba itong mga nurses dito?
Day shift, meron kaming 30 minutes na breakfast, morning break. And then 1 hour lunch break. And then another 30 minutes na afternoon tea break.
Yeah.
So kapag tinotal mo yun, 2 oras yung break mo. And that's protected break. Hindi
Okay.
yun, protected yun. Ibig sabihin ng protected break, kahit gaano ka-busy,
Yes.
kailangan mong mag-break. Pag nights naman, ginagawa namin, iniipon namin yung break ng isahan. So, ang break namin pag night shift is 1.5 hour. So,
Nakakaidlip pa kayo.
pwede kang matulog kahit anong gawin mo, hindi ka istorbohin kahit na mag-code na yung patient mo, hindi ka istorbohin.
Kasi syempre during our breaks naman may handover yan dun sa
Yeah.
covering nurse. So talagang
Right.
protected din yung whole unit pag naka-break kayo. That's very good. Dun sa 12 hours, so usually kapag nasa duty ka, so ano yung mga usual routine mo sa hospital within that 12 hours?
So after I receive the handover, halimbawa sa day shift, I go and check my patients. I introduce myself, kinukumusta ko sila. Very quick lang, and then just a quick glance, like head-to-toe assessment mo, ano yung mga infusion niya, check the monitor, anong meron, gano'n. I prepare their medications, i-explain mo yun, isa-isa, kung may mga questions sila, gano'n. So we do daily ECGs, and then we check the ECG. So, yun yung isang difference in my previous experiences kasi the doctors expect more from the nurses. Given na yung rhythm analysis, pero minsan they expect you to know yung 12-lead ECG reading talaga, any mga axis changes or bundle branch, mga ganon. So,
aside dun sa mga medication, so ano bang usually ginagawa ng mga patient? Are you just washing the patient as well? Or tinutulungan niyo ba silang mag-walk around the unit? Ano yung usual na ginagawa nila?
As much as possible, pagka independent at able ang patient, ini-encourage namin sila to do their ADLs on their own or with assistance. Kasi kasama yun sa assessment natin, yung mobility nila, kung independent, assistance of 1, assistance of 2, chine-check natin yan. Pagka kailangan talaga nila ng full nursing care, kami yung nagbibigay ng bath sa kanila, ng bed bath, with the help of our healthcare assistant or a fellow bedside nurse. When it comes naman to ambulation or mobilization, meron tayong physio. Sila talaga yung main member ng MDT or yung multidisciplinary team na in charge sa mobilization. Although di yun exclusive sa kanila.
Yeah.
So as nurses as well, meron tayong role to be played in mobilization of patients.
Yung mga pasyente niyo ba sa CCU, naka-hook lahat sa telemetry?
Yes, so lahat ng 9 beds na yun, meron kaming may bedside monitors.
Okay.
And meron din kaming telemetry monitor for ambulatory patients.
Dito sa Ireland, iba-iba kasi yung documentation natin sa mga nurses'
Right.
notes. Yung iba still written, di ba? May chart pa rin. Sa inyo ba?
Yeah.
How's your documentation?
Fortunately, ang aming hospital is still going through the process of transitioning to the electronic patient record. So as of now, ang may electronic patient record lang sa aming hospital is the ICU. Still, nagsusulat pa rin kami sa especially yung nurses' notes, OBS, sinusulat pa rin namin.
Right. Regarding sa documentation, curious lang ako. Per hour din ba yung documentation nyo?
Pag cardiology, ang documentation kasi dito by systems, cephalocaudal.
Yeah.
And then by systems yung initial assessment, whatever na mga significant na nangyari within the day or throughout your shift, sinusulat din natin yon. For stable cardiology patients, 4 hourly is enough, or mas kailangan natin ng close monitoring. Then, as needed, pwede nating i-decrease or increase yung frequency. It makes sense kasi as nurses, alam mo, napakalaking oras na nasasayang sa atin in documentation.
That's true.
Nakikita ng mga patients yon na itong mga nurses na to, sulat lang naman ang sulat, walang ginagawa, gano'n. So that's a very nice culture, kumbaga, dito sa Ireland. I would
yes,
say.
You know what? I completely agree with that statement that you made. Kasi dito parang patient first. Alam mo yun, patient safety first. Huwag mo unahin yung documentation kasi you can do that, you know, even at the end of the shift. Kung mabusy ka all throughout the day, you can always do the documentation at the end of the shift. Being here in Ireland for almost 2 years, ano ba yung mga major adjustments na kailangan mong i-deal with?
So, first of all, language. Yun talaga yung pinaka...
Yan, explain to us. Bakit laging ganyan ang sinasabi ng mga na-interview ko? Bakit language?
Marunong tayo mag-English. And then, siguro nga confident tayo sa ating English skills, mataas yung score natin sa IELTS or sa OET. But once you speak na to a native speaker, halimbawa dito sa Ireland, kasi may kanya-kanyang nuances yung English language. So like for me, when I came here, nagulat ako kasi when I started speaking to them, bakit parang medyo challenging yung communication part. Dito sa Ireland, ang spoken English nila and written English magkaiba.
Okay ba?
Magkaiba. Yung spoken is very colloquial. Nahirapan ako kasi yung vocabulary ko parang para sa kanila daw, sabi nila, parang jargon, parang parang highfalutin minsan yung kasi nasanay tayo na ganoon kasi the way we write English, that's how we speak as well. Nagugulat sila para kang nagsi-speech. Parang sabi nung gano'n. Parang kang nagsi-speech. Kasi mahilig silang mag-joke, mahilig yung sarcasm nila is very evident. So, pag tinake mo literally yung words nila, talagang hindi kayo magja-jive, hindi kayo magkakaintindihan. Ganon. Sorry guys, medyo lang. Ito ang this is Ethan.
Ethan.
Say hi.
Okay, you were saying.
Yeah.
Hi, Zach.
So,
hi, Zach.
I guess yung process. They always say na nursing is nursing wherever you go. Parang same lang daw yan. Trying to adapt or trying to know their process. Yung mga little things, yun yung nagmamatter para sa akin. That's my personal style. Kasi very normal for a new nurse in a new job, in a new country, in a new hospital, kailangan mong malaman yon. So dito, as what your previous guests would have said, mataas yung respeto nila sa mga nurses. We can openly communicate even with the consultants, and you wouldn't even feel an air of arrogance sa kanila kasi napaka-polite nila, napaka-respectful nila. They let you feel na you can talk to them. Well, some of them or most of them would encourage you to call them by their first name.
Yes.
Kahit na when you deal with the regs or the registrars sa mga nanonood na from the Philippines, ang equivalent nun is usually yung mga fellow. Hindi pinaparamdam sa bawat isa yung hierarchy. Ganon. Meron silang genuine respect sa iyo, sa iyong opinion, sa iyong experience.
Regarding the co-workers, so since this is a diverse country na, if I may say, how do you deal with your co-workers?
I have noticed na Irish nurses in particular, since nandito naman tayo sa Ireland, they're very respectful, they're very supportive, they're very polite. You've mentioned that na yung workforce dito is very diverse. Na-adapt din ng mga nurses coming from different countries yung kultura dito sa Ireland, which is very, very nice. I wouldn't specify a nationality, pero pag nakita mo yung nationality na yun doon, and then naka-work mo dito sa Ireland, ibang-iba yung kanilang attitude sa work, ibang-iba yung kanilang yung general nila na aura pag nakakatrabaho mo, iba. Creates a very nice working environment.
That is very true. Tama yung sinabi mo. Totoo yan.
Ano pa, ang isang na-notice ko dito, like yung mga pag halimbawa may procedures ka. Dati tayo yung
prepare lahat.
Saan yung where the things, where the equipment, gano'n. Dito, maaawa ka na lang sa kanila at tutulungan mo sila dahil sila talaga yung kukuhan. Whatever they can do on their own, ginagawa nila. And hindi nila inaasa sa mga nurses, which is very nice.
So, ano na bang nabago kay Nurse Cliff? Aside sa family mo na nagpunta na, congratulations. Yes.
Praise God for that. That is one of the main reasons bakit lumipat ako dito sa Ireland from the Middle East. It's a more conducive place to raise children.
For children, yeah.
Ireland is a very child-friendly country. Kids are well looked after dito sa Ireland in terms of their benefits, their health, even in their studies sa school nila. It's not to say na walang mga negative things na nangyayari dito. Obviously, meron yan, nangyayari yan sa lahat ng countries. But compensation-wise, I wouldn't say na there is a huge difference like compared sa sa Middle East ba or wherever. I would say yung salary ko dito, you would earn it sa Middle East pag masipag ka.
Mhm.
Like, kailangan
Extra shift, yeah.
kung mag-overtime ka, ganun. Dito naman, ang kagandahan dito is you have more time with your family. Kasi, imagine, you're just working for 3 shifts, yung 4 days free mo yun, diba? You can work an extra shift if you want. Makikita mo parang walang difference, pero yung mga intangibles, kumbaga,
Yes.
that's what makes the difference.
And regarding the salary, probably it doesn't make a huge difference kasi sa tax din natin dito.
Correct, yes.
Without the tax, it would be like tripled ng salary,
Right.
which is
Oo.
everyone is benefiting naman. For example, our
Yes.
children, di ba? We have our child benefit. Yung mga
Mhm.
ganung bagay, that comes back to the people then. Just want to ask, what are your advices and tips that you can give to our fellow nurses?
Ano ba, sa mga student nurses, siguro, ewan ko, bakit kayo nag-nurse? Hindi, joke lang. Joke lang. Say, go for it. Kung talagang nararamdaman nyo, nafe-feel nyo na this is the right career for you, then go. Pray for it. Pray for it. God will give you your desire. In all honesty, yung happiness natin as a nurse, as an OFW, hindi nababase yon sa kung saang bansa tayo nagtatrabaho. Na-realize ko lang ito nung nandito na ako sa Ireland. Kasi nung nasa Saudi ako, gusto kong pumunta sa Ireland, gusto kong pumunta sa US, gusto kong pumunta sa UK or sa Australia, ganun. Ayoko na dito sa Saudi. Pero nung nandito ako, I realized na kahit na kumbaga gaano kataas yung tingin natin sa isang country na we look forward to working there, meron tayong mga things na manonotice na hindi pala ganun. Kumbaga,
Yeah.
ay hindi pala ganun yung in-expect ko. So kasi meron yung ibang nurses na napipressure sila na they want to work abroad na, want to work in US or Ireland, here in Ireland or UK, ganun. My advice would be be content kung nasaan ka ngayon. I'm not saying na bawal mangarap. Yun yung advice ko para hindi tayo nape-pressure, hindi tayo wala tayong gana sa work. Enjoy natin kung nasaan tayo at the minute. Enjoy natin yon, and then pray for your plans, ganun. Kung pag binigay ni Lord, His timing is very perfect. It's never early, it's never late. Doon natin ma-appreciate na God willed na mapunta ako dito. So ayun lang yung advice ko, and kung gusto niyo talaga mag-work dito sa Ireland, go for it. It's a nice country to work, and then maganda yung benefits. The place is nice. Sige, punta kayo dito, kita-kits tayo. Follow nyo yung sundin nyo yung mga advices ni Nurse Raymond sa kanyang vlog. Very very informative.
Thank you.
Ayun.
Your statements are really valuable. Talaga, they are substantial din. And I'm pretty sure all of the aspiring nurses, student nurses, sinabi mo na din kanina, and yung mga nurses all over the world, not only sa Philippines, will really benefit with this collaboration. And once again, thank you so much. Thank you so much.
Pleasure is mine, Nurse Raymond.
Oh yeah, thank you once again. We're gonna have more featured in this series, Nurse in Action. So if you haven't done it yet, please subscribe to my channel and please follow my Facebook page, Nurse Raymond 123. Once again, thank you, and I'll see you next time. Bye.